Hello, I'm Dr. Stuart Flanagan. I'm an NHS doctor who works in the media, and today I'm going to give you some medical advice. So we're going to think about how to get rid of a migraine. And a migraine is a very severe headache attack, often associated with nausea and vomiting. It's extremely common. It's thought around 1 in 4 women and up to 1 in 12 men are affected by migraines at some part of their lives. Often migraines are triggered by certain things such as bright lights or noise or TV, but for some people they just come on of their own accord and can last for up to 3 days in very severe attacks. It's not quite sure what causes migraine, but for some people it's thought to be that there are specific triggers. For some people there could be a family history, and some people are just more prone to headaches and therefore migraine attacks than others. The two commonest types of migraine are those with an aura and those without. The type without is often a throbbing headache which starts on one side of the head and can go across to the other side, but it can affect both sides at the same time. It can come on quite suddenly and can last for a few hours, and in severe cases it can last up to 72 hours. It's often associated with a feeling of sickness or nausea, and for some people they can actually vomit and be sick. If you're affected by this type of migraine, you'll probably feel that you want to lie in a darkened room and try and get some rest, and that's a really good method of easing things and improving things. The second type of migraine is one that comes with an aura, and basically an aura is a warning sign. And usually this is something visual like flashing lights or objects rotating that comes on before the headache actually arrives. But for some people it can be a strange sensation like pins and needles and feeling of numbness. And often these headaches are even more severe than those without an aura. So what can we do to treat a migraine? Well, first of all, it's important to take some pain relief. Really good type of pain relief are the non-steroidal anti-inflammatory drugs. The most common of those is the over-the-counter drug ibuprofen, or even regular simple painkillers like paracetamol can help with things as well. If you can find one that's associated with an anti-nausea ingredient or an antiemetic, that can really make sure that those other symptoms of wanting to be sick are treated and make you feel much more comfortable. And there are some over-the-counter preparations such as Migrelieve which can help. Something very simple to do is avoid the natural triggers for you. So if you find that flashing lights or bright TV or even noises or sounds are something that can trigger off migraines, try and avoid them and go into a darkened room which is quiet and try and get some rest and see if that helps with things for a few hours. If your migraines persist or become more frequent, then it's important to see your doctor for advice, particularly if you're on medication which can interact with the migraines, or which can have other effects, or for example the combined oral contraceptive pill which shouldn't be taken if you have migraines with aura. So that's some of the ways we can improve the symptoms of migraines.